How to recognize day-to-day symptoms of coronavirus. Hello. And welcome to Your Health and You. In today's video, you are going to learn about the day-to-day symptoms of those affected by the coronavirus, so that you can be able to tell if you or someone else have been affected or not. But before that, take a few seconds to subscribe to this channel and tap the notification bell if you haven't done so yet. It shows you care. Before I continue, please know that this general overview is compiled for self-assessment purpose only, and may vary for each person out there. If you ever fall sick, make sure to immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. This day-to-day symptoms evaluation came to a conclusion from the study of 56 patients from Wuhan Pulmonary Hospital, and 138 patients at Zhongnan Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital. These symptoms are broken down into 22 days time frame. From day 1 of being infected to day 22 of a possible recovery. From day 1 to day 2, the early symptoms are similar to the common cold, with a mild sore throat, and you may not feel feverish nor feel tired. Patients at this stage can still consume food and drink as usual. From day 3, the patient starts to feel a bit of pain in the throat. Body temperature will begin to read around 36.5 degrees Celsius. However, patients will still feel no signs of fever. It is also uncommon that other symptoms like vomiting, mild diarrhea or mild nausea are possible to begin manifesting. On day 4, the patient's throat pain becomes more serious. At this point, other symptoms, like feeling weak and joint pain, start to manifest. The patient may start to show a temperature reading between the range of about 36.6 degrees to 37 degrees Celsius. Starting from day 5 to 6, mild fever starts. The patient temperature will at this stage rise above 37.2 degrees Celsius. The second most common symptom, dry cough, will begin to manifest. Breathing difficulty may also occur occasionally. Most patients at this stage are easily feeling tired. Other symptoms may remain just the same. These 4 symptoms just mentioned are among the top 5 key indications of COVID-19. As noted by the final report of the initial outbreak conducted by the collaboration of China and WHO. If by day 7 the patients show no signs of recovery, then they get more serious coughs and breathing difficulty. Fever at this point can get higher, up to 38 degrees Celsius. Patients may develop further body pain and headache or worsening diarrhea if there's any. When it gets to this critical stage, many patients are admitted to the hospital. If the patient already has an existing health problem, then, the symptoms are likely to be worsened by day 8. Severe shortness of breath becomes more frequent. Body temperature will exceed above 38 degrees. In one of the studies, day 9 is the average time when sepsis starts to affect about 40% of patients. Day 10 to 11, doctors are ordering imaging tests, like chest X-ray, being done to capture the severity of respiratory distress in patients. It is at this stage, patients are having loss of appetite and may start having abdominal pain. The condition at this point in time needs an immediate treatment in ICU. By day 12 to 14, those who survived the symptoms can be well managed at this point. Fever begins to get better and breathing difficulties may begin to cease on day 13. However, some patients may still be affected by mild cough, even after hospital discharge. Then by day 15 to 16, those that finds it difficult to recover must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19, the possible chance of recovery of such vulnerable ones becomes slim. But before that time, Vulnerable patients may develop a secondary infection that is caused by a new pathogen in the lower respiratory tract. This severe condition may then lead to blood coagulation and ischemia. While by day 20 to 22, the surviving patients are recovered completely from the disease and are discharged from the hospital. This video should help you see that the coronavirus is real and that you should do your part to curtail the spread. Thanks for watching. Share and subscribe if this video was helpful. And don't forget to leave your helpful comments below in the comments section, and together we will overcome the coronavirus. See you in the next video.